The beating in your chest is a good thing. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to Your Smarter Heart University, and to everybody out there arguing now, because we got a little text that said there's a big argument and we've created some controversy. Great. Good. That's what we're here for. So we get 80 to 90% of vitamin D3 from sunlight. What percentage do most average humans get to sunlight exposure?
I said 5.
Okay. Well, if you expose yourself daily to sunlight, you can get 10 to 20,000 units of vitamin D3 a day. Most humans, however, get less than 5% of their skin exposed, leading to an overall 25 to 57% deficiency in vitamin D, depending on how old you are, your socioeconomic status, and a lot of other factors we're not going to go into. There are 5 forms of vitamin D, folks. Traditionally, vitamin D has been known to influence your bone and calcium metabolism. That's what we always looked at it from that standpoint. Vitamin D, 2 and 3 have been the most studied. Vitamin D3 is your main form, and it's usually consumed in terms of your diet from oily fish. Again, like omega-3 fatty acids, salmon, mackerel, herring, and sardines, the big ones. That's where you get vitamin D otherwise. We normally measure the circulating form. It's called serum 2,5-hydroxy, or OH, vitamin D. That's your D3. And the most beneficial levels are usually greater than 30 nanograms per milliliter. Just remember 30, folks. And deficiency is defined as less than 20 nanograms. So low levels of vitamin D from a cardiovascular standpoint have been well associated, documented with hypertension, diabetes by making you resistant to your own insulin, peripheral vascular disease by increasing calcification in your arteries, high or abnormal cholesterol, coronary artery disease for the same reason, heart failure, and abnormal heart rhythms. All of them have been associated with low vitamin D levels. So the 3 big questions often raised are, first, what is the optimal vitamin D level? Second, who should get supplemented and how much? And lastly, is there truly a benefit to vitamin D supplementation? That's going to be fun.
That's the question.
So, number 1, what is the best level to have? Based on a variety of cutoff values that have been studied, it appears that levels less than 15 have the highest frequency of cardiovascular disease, and risk was seen with the 2,5-hydroxy vitamin D levels up to 20. So again, somewhere between 50 and 20, it's bad news for you. Since vitamin D plays a role in maintaining normal serum calcium levels, maximum calcium absorption, therefore, is generally seen when levels are between 30 and 40. And this is an important point for everybody to know. And often a lot of our patients are taking Caltrate or one of those supplements with vitamin D and calcium together. So between 30 and 40 gives you that maximal calcium absorption, especially when you're taking calcium supplements too. So from an anti-aging standpoint, that's one of the things I practice, somewhere between 40 to 60 and 55 to 90 nanograms have been suggested as optimal or ideal levels. You know, and from an anti-aging or integrative or complementary perspective, we're going to talk a lot next week, you know, they always like to get somewhere at least smack dab in the middle of what's the highest and what's the lowest, because that gives you optimal benefit for no disease and longer living. Number 2, how much is enough? Okay, current daily recommendations are set right now for the upper limit to about 2,000 international units of vitamin D3 a day. Probably somewhere between 800 to 2,000 is a good goal for all of you out there. For those with severe deficiencies, a bolus, and that means like a large dose of about 50,000 units once a week for about 8 to 12 weeks, is the standard that your family practitioner or internist has been recommended, and then beginning this maintenance dose, as we said. Since sunlight is not your best bet, obviously, to get vitamin D3, and any sunscreen, believe it or not, this is a fact, with SPF 15 or greater, blocks vitamin D production by 99%. If your level's low, take a supplement and eat some fish. Okay? Of note, the darker your skin, the more pigment you have, that also significantly blocks vitamin D absorption and production. So will vitamin D, lastly, make me live long and prosper? It has often been observed that there are vitamin D receptors in your artery lining, and deficiency therefore leads to stiffening or thickening of the arterial wall, and this could, of course, could lead to hypertension and heart disease. That's the speculation, and older studies said taking vitamin D benefits this. Let your arteries become more relaxed and not thicken. Such is the case with all vitamin supplementation we've said so far, older versus new, versus new. The older retrospective studies have been overshadowed now by two newer meta-analyses, if you will, two trials this year, again, fresh off the paper, that shows only a slight, statistically non-significant reduction in cardiac events, as well as a non-significant reduction in systolic, or your top number of your blood pressure. So the conclusion from these startling revelations was that it's too soon to draw a definitive stake in the heart of vitamin D supplementation. So many people take vitamin D and calcium, as I just said, for bone health. And one observer put it best: the available evidence in favor of vitamin D supplementation is far, far more promising than other vitamins and mineral supplements. And, folks, a large National Institute Health study of about 20,000 men and women using both vitamin D and fish oil, that's a good idea, to see if they can reduce the risk of heart disease, stroke, and cancer is ongoing. We will have that study, and Smarter Heart's going to be in existence, so we will present it to you when that finally gets done in a couple of years. Pretty good, huh? Did I pack it in there?
I think it is. And vitamin D, it gets back to our first segment when we were talking about homocysteine. Yeah, if you have low vitamin D, and remember, we're talking about heart health here, not bone health. That's a different show, a different issue. Vitamin D is important for calcium absorption and prevention of fractures. But from a heart health standpoint, if you have a low vitamin D level, yes, your risk of heart disease is higher, just like homocysteine. I think vitamin D, it's too early to tell. I think from a folate standpoint, well, I used to think that folate, the data was in on folate, but maybe long-term is different. Supplementation with folate lowers homocysteine, but it didn't really do anything so far, except for maybe that Japanese study, for reducing events. Vitamin D, there's, I think, a little bit more excitement about vitamin D than there is folate. Clearly, it doesn't hurt. At least so far, we haven't seen any harm.
Anything that we've done, B6, B12, and folic acid, to lower homocysteine never hurt. And I think taking extra vitamin D, there's really no toxicities. You can be toxic. There's no question you can be toxic.
Yes, you can be vitamin D toxic. You can take too much vitamin D.
Right.
But taking a proper dose, as prescribed and recommended by a physician, there's no data that suggests yet that we're going to harm, but I'm more excited about the data on vitamin D. The recent meta-analysis notwithstanding, I want to see what this randomized trial that the NIH is doing. That's always the best trial,
of course.
And we're starting to check for more of it. And
we check it. We have it actually on our labs.
A little personal lab.
We have it actually our personal labs to check it off on a regular basis, because it's a marker, and anything that we can check as a marker, as long as we can get it paid for by the insurance companies, and that's a big bone of contention as far as I'm concerned. I want to do it because if we can do it and then pass it on to our primary doctors and let them, make that prescription based on their analysis of their patient, I think it's the best thing to do for everybody out there.
You made the point. I want to, as a very light-skinned person,
you and I both.
The idea of sunscreen. I did not know. That's a little piece of information for me. The idea that by putting on sunscreen, I'm going to reduce my vitamin D production when I'm out in the sun. For me, I'm going to, I think
skin cancer,
I'm going to continue doing it because I can take vitamin D in a good diet and supplementation if I need to. I'm not going to not wear sunscreen just to get vitamin D and increase my risk of
well, folks, my level was 29. My level was 29, and because I saw that, and I eat more fish than I can imagine, and I love salmon 2 or 3 times a week. And I was reading an editorial from another doctor, and she said the same thing. I'm on 2,000 units a day. So I saw that, and again, 30 being, or better being, I said, there's no reason for me not to take somewhere between 800 and 2,000 units a day. Since it comes conveniently in a 2,000 unit form locally by us, I started on it, and I'm going to check my level again and see where I'm at. So it's simple to do, and these are easy things, any more than you would get a PSA for your prostate or a mammogram for breast cancer. It's easy to check a vitamin D level and a colonoscopy and all of those preventative measures. Vitamin D should be up there as far as I'm concerned with preventative things from a cardiovascular standpoint and osteoporosis. I think, we're getting to this point where screening, primary prevention, getting, as we always say at the end of our show, getting to it before it gets you, right? So if we take this primary prevention in lieu of where we are right now, we have to get aggressive and get aggressive.
Right. The problem is primary prevention. We don't want to get into the economics of things. We want to stay with the science. Yes, we want to prevent a disease. That's what Smarter Heart is all about, is preventing disease. Hopefully we can convince the powers that pay for all of this that primary prevention in the long run is better for us than does it cost less money.
It's got to swing around. I think it's got to, because we've got to get out there and be proactive. Everybody has to get support of the patient, the physician, every allied health personnel. I mean, everybody needs to get together, because all the things we talked about this on our cardiac markers that could save your life radio show.
Yeah.
I mean, these are things that we did for the past 5 and 10 years without ever even having to bat an eye and wonder about a code. We just ordered them, and now every day I'm coming back even with a vitamin D level, and my staff puts that out. Yeah. So let's go on for pop quiz number 3. What percentage of adults report using a multivitamin or mineral supplement daily? 25%, 35%, or 45%?
Let's say 45%.
45%. We'll be right back on your Smarter Heart University on AM 970, The Apple.